So we'll be starting with the trigger point releases from the bottom up. So we'll be starting on the bottom of the foot. So this is a right foot. So if I was standing and facing you right now, this is how I would be looking. So this is my right foot, this is my big toe, little toe, and bottom of the foot. So when we do the treatment to the foot, it's the same as to anywhere else in the body. You want to apply 30 seconds of pressure to any tender spot. You could, however, apply more pressure if you would like. When you apply the pressure, you should apply it with moderate force so it is, we'll say, uncomfortable but not painful. It is very important when you do these techniques that you do them so that it's uncomfortable but you're able to keep the muscle relaxed. I have had only a very few people in the past actually have a bruise after something like this. You should not have a bruise after you do this, even if you're on blood thinners. If you have that, I would say you're pressing a bit too hard. But you're going to use moderate pressure on the tender points, and you're going to hit all the tender points that you possibly can find on the area that you're working on, whether it's a foot or anywhere else. So when we start on the foot, you're going to be sitting. That's important, and I'll show you this in a minute, but you'll be sitting. And somewhere on the bottom of the foot by the heel here, somewhere in here at the kind of front end of the heel, you'll probably find a couple tender spots here. Usually right here in kind of the middle of the arch of the foot, or kind of the back part of the arch of the foot, you'll find another tender spot there. However, if you bear weight or walk on the outside part of your foot, you may have some over here. And if you've got a flat foot, you'll probably have a few through here on the instep. If you've got plantar fasciitis or a heel spur, you most definitely will probably find some back here too. If you've got a heel spur and you know it's right on the bottom of the heel, I would not encourage you to put pressure directly on it because it can actually cause more irritation. But if you still work all these other areas and areas in the calf, many times it helps. If you have a bunion where the big toe is kind of buckling in, many times the areas through here, and if we look on the inside of the foot right through here, you'll also find a few trigger points as well. I won't be demonstrating this, but the principle will be apply 30 seconds of pressure to the tender spots. I'll be using a ball to do this. That's how I would generally encourage you to do it at home, but you could use any of those other tools that I talked about. To treat the foot, place the ball underneath your foot. I'm using a lacrosse ball. Find a tender spot. I have a tender spot right here. While I'm sitting, I'm going to be pushing down with moderate pressure. I'm working very hard at trying to keep my foot relaxed. I will hold the pressure here for 30 seconds. After 30 seconds, I'll roll the ball underneath my foot, forward, backwards, side to side to find another tender location. Hold pressure there for 30 seconds. After I've treated all the tender spots on the bottom of my foot, I roll my foot on the ball, front and back, side to side, to basically massage my foot for about 1 to 2 minutes. Now we'll be doing the calf muscle, or the gastrocnemius, and the soleus. Technically, the plantaris is part of kind of this muscle group going into the Achilles tendon or triceps surae, but it's so small, I think if you get it for the most part, you might be getting it by accident. So remember, the calf, with the muscles that make it up, connect a little bit above the knee to kind of this area in here, and they connect all the way down to this area here. Some cadaver studies show that it actually connects to the bottom of the foot. So if you treat your foot first and you find that your calf feels looser, I wouldn't be surprised because everything's kind of interconnected through there through a lot of connective tissue or fascia, if nothing else. So when we're doing the gastrocnemius, the muscle that looks like a heart upside down kind of on the back of the calf, on the upper part only, you don't have to apply a lot of pressure there because it's a superficial or close to the skin muscle. When you're doing the soleus, which is beneath this muscle or deep to it, which kind of runs from this area here all the way down to, again, the Achilles tendon, you might need to use a little bit more pressure by putting your other leg over the top, especially with the technique I'm going to be showing you. Just like everything else, find all the tender spots that you possibly can, and I'll show you a technique that I use to do this. To treat the calf, I usually start with the ball. I'm using a lacrosse ball in the outer part of my calf first, because I know I have a tender spot there. I'm just relaxing my leg on it because this is a superficial muscle and you don't need a lot of pressure. You could sit up like this, or you could lay back if you'd like. It doesn't matter. Whatever's more comfortable for you. You must make sure to relax your leg on the ball. If a muscle's not relaxed while you're doing this, it won't be very effective. After you hold the pressure on this tender spot for about 30 seconds, if it is tender for you, you're going to move the ball to the inner part of the calf. If you have a tender spot there, relax your leg onto it for 30 seconds there as well. I'm going to move the ball to the lower part of my leg. I'm going to cross my other leg over the top. And now we're going to put deeper pressure on it by the weight of my other leg hanging here, as I'm still keeping my leg that I'm treating relaxed at the ankle and knee. And we're applying deeper pressure now to get to the soleus. We'll basically do this potentially almost all the way up to the knee here. The ball's right here right now. And almost all the way down to the Achilles. Right now the ball, if you can't see it, is right about here. Any spot from the top to the bottom where I just showed you is potentially fair game for this muscle to be problematic. And don't forget to potentially roll your leg in or out to find those tender spots, because usually there's quite a few, especially in runners. After you're done hitting all of these tender spots, how to do a massage, you can use a foam roller if you would like, which we didn't discuss before, as far as tools or equipment that you could use. Or you could just use this ball, where you want to try to keep your leg relaxed and roll yourself up and down. Usually I would recommend doing this for about 30 seconds to a minute, again, to flush out those chemicals from the trigger points that you're trying to release by changing the blood supply. Next, with the help of Gary here, I'm going to show you how to release the tibialis anterior and some of the toe extensors, the muscles that lift your toes up. Doesn't seem like something that we need to do very well, but it helps create a very important synergy or tensegrity, or basically a balancing of how the foot and ankle work. Many times if these get tight, they do limit your ankle action as well, can limit how well you can run, walk, things like that. So these muscles, if we look at Gary's right leg here, are kind of attached to these two bones, and it's more on the outside part of the lower leg. You'll feel it. There's some meat down there. You don't want to be right on the bone, though. Maybe just on the outer edge of this bone here, the tibia, the larger of the two leg bones, but you want to be on the outer rim of it. But basically, just like everything else, we're going to search out the tender spots somewhere between kind of here and down here, and applying 30 seconds of pressure to each tender one, followed by doing a little bit of massage. You won't be able to see much of what I'm doing with this because of the position I'm in, but I want you to appreciate the position I'm getting myself into to be able to do this. So what we're going to be doing to put pressure on these muscles is I'm taking a lacrosse ball again. I'm putting it underneath my leg in that spot I just showed you on Gary, and I'm just kind of rolling my leg in and out a little bit, and right there, I just found a tender spot, and I'm just kind of relaxing my weight onto it. If it's too tender and I can't relax my foot or ankle, don't forget to relax your body onto it. But if it's too tender that you can't relax, it's not going to do you any good. So if that's the case, you can shift a little bit of weight off the ball. If for whatever reason your knees don't bend well enough to do the trigger point releases in this position, what you could do is sit, maybe use the same ball, roll it up and down your shin, kind of find that tender spot and push it in with your hands. I find this is awkward for the back, and at that point in time, that's where a theracane or some sort of implement like this comes in handy. So you can take the curved end of it, not that you'd have to, and basically kind of push in there. Make sure to keep your leg relaxed. It's very easy to not, and just hold that pressure there for 30 seconds. Now, if you're using a theracane implement, However you decide to use this, after you're done with hitting all of the tender spots and treating those for 30 seconds each with sustained pressure, then you would use a cane to kind of massage up and down your leg with this. If you're using a ball, I think it works better to basically just kind of rub your leg up and down like this. I think it just works a lot better. It's easier to put pressure on it. It's much easier to keep your leg relaxed.